We mama wa ukimwi, enda kwa ile dirisha uchukue dawa pande hiyo. I have terminated 43 staff of WOFAK because we were being supported by both USAID and PEPFAR. We had a project on orphans and vulnerable children. We are supporting orphans to pay school fees, for the girls' sanitary pads. The advocacy started way back. I remember also as leaders, we work together with other countries internationally. You cannot wake up one day and you tell your sexual partner that, today we have to use condoms. It wasn't easy. For now, we are helpless. I'm jobless. If you have one, you can give me. Yeah, so yeah, it is that tough.
Welcome to another episode of Development Perspectives Africa. My name is Fiona Imbali. Today, we are privileged to have the CEO of WOFAK Kenya, Women Fighting AIDS in Kenya, where we shall delve into the issues of HIV and AIDS in Kenya and Africa in totality, and what the suspension of USAID means to the people in Kenya, and especially to the rural people in the country. Thank you. Welcome. Please introduce yourself.
Thank you, Fiona. I'm happy to be here. My name is Dorothy Onyango. As you've said, I'm the CEO of Women Fighting AIDS in Kenya and also founder member. I am a mother. I have 3 and a grandmother of 3. Actually, my last grandchild is 2 weeks old now.
Wow.
Yeah, so I'm happy to be a grandmother. It has been a long journey, but here we are.
Thank you very much. You're very vocal on issues to do with HIV and AIDS. Do you mind telling us how this journey started and what really made you stand out amongst the very many people who are very vocal about these issues?
Wow, that's a tough question. Okay. I happen to be HIV positive. I was tested in 1990. That means it's about 35 years now. And the reason why I came out to be a leader is because I realized that I was not the only one who was HIV positive. And the time I was diagnosed was the time when people were dying. You could see billboards with people who were emaciated. And probably I was lucky enough because in 1992, there was an international conference that was being held in Amsterdam. And apparently the women of the West had already organized themselves, because for us it was death sentence rather. And I think they had organized themselves, and therefore they started an organization known as International Community of Women Living with HIV. And I was privileged to attend this meeting in Amsterdam. And before the main conference, there was a pre-conference that had 24 women from all over the world who were HIV positive. And in fact, when I was going to Amsterdam, I thought when I got to the airport, I would meet these women who were emaciated, who were sick, who were thin. Apparently, that was not the case. And there were mixed women from all over the world. And Africa, we had 24 women who are HIV positive, beautiful women, smiling, but inside them, they had a problem, which is HIV/AIDS. Some had lost their husbands, some had lost their boyfriends, some had lost their children, and of course, relatives to HIV. So we just discussed, we were laughing. It was a whole week meeting for HIV positive women. And we just discussed anything and everything about ourselves, about our children, about our spouses, and how we were coping. But of course, we knew that HIV is equals to death then. So I remember when I went to the clinic for my test, I was told I had 6 months to stay. So here you are, you have children, you have work, you don't know where to go. And so we were just conversing. Of course, we knew we were going to die very soon then, because there was no medication for us. And if there was, because the West already had medication, it was very expensive. We could not afford. Most of us could not afford. So for me as a leader, what I saw is that the discussion was that when you come back home and if you can afford, or if you have a space or office where you can invite women living with HIV and discuss on issues that affect them, then that would be great. So that is exactly what I did. I took that step. I came back. That was in 1992. I came back to Kenya, and really to the word, what we discussed, I decided to come up with an organization, which is WOFAK, and it was registered in 1992 as an NGO. And our main aim to start this organization is to empower women to do counseling. Of course, we were not counselors. So it's very interesting that all the women, we just came together and in fact, what we did, confrontational counseling, because we were not counselors, and we were just women living with HIV. So um, for a long time, that's what we did. We did counseling the way we knew. People came, you cry together, and you just talk about it and say, okay, you have another day to live. You have another day to live. But I think the advocacy also in us as leaders also helped us, because I remember way back when Awori was the Minister for Health. We just came out boldly as women living with HIV and other people who are concerned. And we walked to Parliament with placards and we said, if we don't get medication, we are going to make sure that everybody else is infected, including the members of Parliament. And that is where we started. And in fact, our advocacy worked, because we managed to get medication, HIV medication, which is ARVs, free of charge. And people could get them from different, I think those days it was provinces. In the government hospitals, we were able to access medication, although it was not the best medication, because usually in Africa and in Kenya, we get what people have already used, and they have better ones. But so it was better than nothing.
Yeah.
Of course, it had some side effects that we didn't mind. It's because people came thin. You lose your body shape, and your legs become thin. Depending on your body, I think makeup. So the advocacy started way back. I remember also as leaders, we worked together with other countries internationally. And I remember there's a time we went to New York to the UN General Assembly, and we were women leaders from different countries. And I think in the history of UN, there has never been demonstration within the UN complex. So we actually had placards inside our t-shirts, and then when I think the Secretary General started speaking, we just went straight into the front and we lifted our placard and said, we want equality, we want equity, we want everybody in the world and in Africa especially to get medication. And we were rounded up by the police and our passports were taken, and we knew we'll never step into America again.
Yeah.
Luckily, Kofi Annan was the Secretary General then, and he talked to them and they managed to give us back the passports, but we never went back to the meeting.
But the message was passed.
The message was passed, yes. So it has been local advocacy and international advocacy, and as I told you, the people in Europe and America were already organized. So really, it helped us also when we came back home to Kenya to know how to deal with our governments.
Yes. Very well said. In the 90s, I remember I was very young. There was a lot of stigma around HIV and AIDS. And just 2 years after you were diagnosed, you actually started advocacy and talking about these issues openly. I'm just wondering, how did your family take it? How did your friends take it? Weren't you afraid of the stigma that was quite rampant back then in the 90s?
It's a long story. Stigma was really real then. Um, I can say for a very long time, I was helping those other women. It was not like I was saying it openly that I'm HIV positive, but we were supporting those group of women, because you have small children. My kids were still in primary school, and I wondered how if they knew that I'm HIV positive, what will happen as a single mother. And so usually I will be open outside the country and not in country. So I think I became open after probably 5 years after my diagnosis. And I think I told my auntie, who I thought I was very close to, and I told her not to tell anybody. But at that time, I was in London. I was in a meeting, and I actually sent, it was fax those days. And immediately she read my fax. She called my sister and my brother, and she told them, "Okay, Dorothy is going to die. She's got AIDS." The people didn't know the difference between AIDS and HIV. So she called them for lunch, and they decided that I mentioned I have three children. So my daughter was already in boarding school, my firstborn. And then my two boys were with me in Nairobi. So my sister took one of my sons and took them to a good school where their kids used to go to school because they knew I was dying. Then my brother also took my younger son and took them to a good school where the sons were going. It's not that they were taking them to different schools. So for them, I was dying. But even for me, I think it was a blessing in disguise because those days I had not started taking medication. But, because you're desperate, people say, okay, today there's a medicine that has been found. So there was Cameron, I took Cameron. Then there is the Obel one, then I took that one. But I was doing in hiding because these things were even very expensive. I remember Cameron was 100 shillings per day, and I had to take it every day in silence. So I think after 5 years now, I started coming out slowly. I think there was a magazine used to be written by one of our positive ladies who we met in Amsterdam. She used to write a magazine called World. And the first gentleman who talked about the HIV status is called Lawrence Lenya. He he asked me for my picture, passport size photograph, and I gave it to him. I didn't know what he was going to do. We use it for. So he sent it to this lady. She was called Rebecca, and she published my story. And one day he calls me to his office and says, "Read this." And I say, "It's my picture." I said, "Oh my goodness." I was so annoyed. But yes, it happened. It was a way of helping me disclose, but still it was not really, really open because I wanted my children also to grow up and
Be protected,
yeah,
from the public.
from the public. So I said, okay, I want to see them get to secondary school. This happened. My son went to my daughter was already in boarding school in Central Province, and my second born was in St. Mary's Yala, and the last one was in Mango High School. So I said, okay, I'll tell them when they finish school. It wasn't easy. Then I said, let them go to university. So what I did is that I made sure my children went abroad because I thought I was going to die, and people would see me, you're a teen, and I didn't want my children to see that. So I said, let me send them to the university abroad so that when I'm dying alone here and I'm emaciated and I'm bones, they are not going to be traumatized. Unfortunately, that didn't happen. I don't know whether it's fortunately. I'm here many years after.
Yes.
And they're married, I have grandchildren.
Yes.
So when I asked, I think I was giving a presentation in Washington, and I took them, my two sons. And after my presentation, as I was coming out, I asked them, how did you feel about my presentation? And they said, Mom, we knew. I said, oh my goodness, how did you know? But you remember we used to go to school, and then we are going for scouts, and we would bring you CDs with people with HIV, stories, magazines. We found your results in your bedroom because they would come to my bedroom and watch my television instead of the sitting room, and said, we found your results, and that's how we knew. And then how have you been coping? I said, Mom, it's God. So I said, oh my goodness, all these years I've been hiding from them, but they know.
Quite intelligent for their age.
Yes. Yeah.
Wow.
I said they have been praying for me.
Mm.
Yeah.
So did you personally experience stigma?
I would say that probably self-stigma. But outside stigma, I don't think I did because, as I mentioned to you, I met this guy who had disclosed his HIV status. So probably the stigma that I would say I had faced is just people pointing out because somehow it leaks out and people know that you are HIV positive. So probably the one that just people talk behind your back and when I'm in our networks at drop-in center, I'm just comfortable. So I wouldn't say that I realized stigma like any other person. No, I wouldn't say that. I think probably my travel and my meeting with other people helped me to know how to face issues whenever it came. And I think the first hospital where I went, it was research at Cambridge. It's a research institute. So everybody who was going there was HIV positive. Despite the fact that when you meet there, nobody's talking to the other. You're imagining what everybody is thinking about. But I don't think I have encountered stigma as a person. Maybe the stigma I would say I realized was when my brother and my sister took my kids away to take them to school. But surely that was a positive stigma for me. Yeah.
Yeah. Having been diagnosed and told that you have 6 months to live, 35 years later, you still have a story to tell.
Yes, I'm a grandmother,
Thank you.
and I'm not ending there.
Thank you.
I still have a long way to go.
Thank you. Also, something about family, the role of family in just ensuring that people are not stigmatized, people who have HIV and AIDS in the country. Tell us, how did your family support you? Of course, apart from taking your children away to great boarding schools, how was the environment for you as a person living with HIV? And what is the role that the family really played in ensuring that you are well kept and you have a story to tell 35 years later?
I think they were very caring. My family were very caring. Of course, I had a job. All of them had jobs, and yeah, they would always worry that when I'm sick, they said, "Oh, are you sick?" Or if you don't call them, they will ask, "Rod, you have not called us. Are you sick?" I said, "No, I'm not sick." Um, what makes you think that I'm the only one who can get sick all the time? And I think one time I told my brother that, you know what? You people, I'm going to bury all of you and leave me here. So from that time, they stopped asking me. Of course, you can see they are very cautious the way they handle you.
So you actually treated like an egg.
Yes, like an egg. Yeah, they were very loving and worried.
Yes.
Yeah,
Which was a good thing.
which was a good thing.
So you ended up being treated like a last born in the family, who is very well loved.
Yes, yes. And you know, even in the village, I became a doctor because my dad would call me and because he knew, he would call me and say, now, you know, this so and so, I think they have that disease. You know, they can't even say which.
Yeah.
They have, how do we help them? And then I tell them, okay, tell them to do this. And then another one comes and this. So it's really my happiness that I can support people. You know, I think my for my challenge with HIV became something positive
Yes.
for others.
Yeah.
So I feel very good when I see people that have gone through WOFAK, um, do their work, they are married. Everybody calls me mom. Mom in the network, it's mom, mom, mom. Sometimes I go to social places and somebody comes, do you know me? I said, no, I can't remember. Oh, you paid school fees for me.
Wow.
Oh, you paid for my college. And you know, there are so many. And it makes me feel good and it makes me continue doing what I can do.
Yes.
Yeah.
The first incident of HIV was discovered in Kenya in 1984. 41 years later, they still say that disease. They don't call it by name.
Yeah.
So does that encourage or enhance stigma in a way?
I think it does enhance stigma because ideally, most people relate it to sex. she got HIV because she was promiscuous, or nobody thinks that you could have gotten it in your house, like you said, from your husband, who also got it somewhere. But because it's mostly through sex, then yeah, there's still that stigma. People still talk about that thing.
Yeah.
Yeah,
That disease.
that disease. Hii ugonjwa yenyu. But, sometimes they say hii ugonjwa yenyu. I say hii ugonjwa yetu gani?
Wow, what a story. Also, I remember in the 90s, you talk about advocacy. The advocacy on HIV and AIDS, also the messaging was quite scary. I remember in the televisions and radio, they will talk about HIV and they will show photos of people emaciated, people actually dying the next day to scare people away, to just scare people from, I don't know. That messaging was it quite effective? Because a lot of people were scared, yes, but did it prevent or did it stop the infection rates from going high?
I think, I don't think that worked because it was actually scaring people. And that means that you wouldn't even go to a health facility to seek for medical support because you would be scared that they will know you are HIV positive. So you would continue with your sexual activities, women, men, and therefore the infection continued. But you see, like now, when you take medication, your viral load is suppressed to undetectable. So you cannot even infect your sexual partner or even children that are born from mothers who are infected by HIV. So I think it was scary. We didn't have information. Everybody didn't have information. So as I told you, also we used confrontation counseling. So even the government was using a way of scaring people that they should not have sex, which was not possible. And you cannot wake up one day and you tell your sexual partner that, today we have to use condoms. It wasn't easy. So, but I think that was their only way of advertising that there was this disease with us, but it was not the right way to do it.
Yeah. You've worked with a lot of women in this country and also in the rural areas. How was it like to just ensure that these women's voices are heard? Because we live in a patriarchal society. Even in 2025, we still have women who really do not have voices. And when they speak, they are not heard. How did your organization work towards ensuring that women's voices are heard with regards to HIV and AIDS, and also especially when it comes to protecting themselves?
Thank you, Fiona. I think probably I didn't mention what WOFAK does, but our main aim as an organization is to empower women to ensure that they live their lives positively as women living with HIV. We train leaders to be able to go back to the community because Dorothy as a person cannot go everywhere. So WOFAK is a national organization. So we have branches in different counties, and especially where HIV prevalence was quite high. So we had quite a cocktail of activities that we did within the communities, and more so in the rural communities of Homa Bay, of Mombasa, of Kwale, Kilifi, and Kisumu, and many other places that we had presence. So we did train women to go and talk to other women in the community, not necessarily those who are living with HIV, but the general public. And we also worked very closely with the administration, like the chiefs, to be able to give us space, especially during baraza, so that we could create awareness among people. And more so, our target was women living with HIV, young girls, and of course the general awareness that we talked about on social media, which is mostly was the television or radio. And of course we did even train like peer educators who would walk into the community and talk about HIV. And that is how we have managed to get to where we are. I just want to say that quite a number of women who went through WOFAK have been able to be leaders. Actually, currently the program manager at UNAIDS is a product of WOFAK. Um, We have others who actually are abroad. They are leading organizations as CEO, as directors. And there are others that are coming up. And right now we have young women of about 30 who are born with HIV. And we are also making sure that we empower them. We front them for to be leaders, both at national and at international level.
Wow, thank you very much. Having been advocate for people living with HIV and AIDS for many years, um, do you have current statistics of the numbers in Kenya, people living with HIV and AIDS, and what that means in terms of planning for the government?
Currently, Kenya has 1.4 million people living with HIV. Over a million are on medication. And you know what being on medication is and adhering to your medication. We have when you take your medication correctly, you will not infect your um, sexual partner. When you take your medication correctly, you will not infect the unborn baby. So we have 1.5 million in Kenya, around there. We have, I think, 26 million people who are infected with HIV in Africa, and about 45 million worldwide. So the reason why you don't see very many people dying with HIV every day, remember it used to be, I think, 500 or something per day, but now we have less people dying of HIV. Unless you really neglect your medication, you're not taking it correctly, you should live a normal life, and you can see I'm living a normal life as a person living with HIV. Um, I only have HIV, I don't have AIDS. Yes. Until such a time that I stop taking my medication and uh, I abuse that, then I'll get to the AIDS state. Yes. And yeah.
Yes. The HIV and AIDS epidemic has evolved over the years in Kenya. What progress can you see has been made in terms of treatment, prevention for the people living with HIV and AIDS?
I think the progress that I say we have seen is actually mother to child transmission. You can now see children are being born free of HIV from infected mothers. Um, we can see that quite a number of people are not dying of HIV. And in terms of prevention, we even have medications for the same. We have prophylaxis. We have organizations of and networks of people living with HIV who are able to go out there and they talk openly about their HIV status to create awareness, to support those who are infected with HIV, despite the stigma which is still there, but it is not as much as it was. So yeah, we are managing stigma. We are giving HIV a human face. Like I'm talking to you now, we are the same. I mean, it doesn't show on my face.
Not at all.
Yes.
You actually look very lovely.
Thank you. And of course, if people who are HIV positive walk out there, you will not say that this is Dorothy is positive and Fiona is positive. Yeah, we are the same people. And yeah, I think we we have done quite a lot of work to ensure that our peers are able to work without stigma. We actually even go monitoring the facilities to ensure that people are not stigmatized when they're getting their medication. And I think the good thing we had was that the government put in place the comprehensive care clinics that are managed by people living with HIV. So when you get into the clinic for your medication, you know that it is your peer, it's your colleague, it's your sister who is in there. And that has also helped destigmatize HIV.
Very well said. Now, with the recent suspension of the USAID funding, which has been quite critical in just helping supporting HIV programs in Kenya and sub-Saharan Africa, what does it mean for the sustainability of HIV treatment, care, particularly for the rural people and the very poor people in the country?
I think it is a very complicated situation. As I sit here, I have terminated 43 staff of WOFAK because we were being supported by both USAID and PEPFAR. And the 43 staff come with a project that they work on. So like now, we had a project on orphans and vulnerable children. We are supporting orphans to pay school fees for the girls' sanitary pads, and of course we have the peer educators who do referrals. So one of our projects had about 4,000 orphans and vulnerable children that we support. Um, that one has been cut. We have peer educators, about 2,000 who work under them. Um, Also, them, they don't know what to do. And this is not only for WOFAK, this is across board. All the other organizations that were being supported by PEPFAR and USAID have actually sent staff home. And what does this mean? Our ARVs were mostly bought by the donor fund and especially PEPFAR. So there are actually clinics, many clinics that has been closed, which were safe clinics for people living with HIV, where they would get their medication. Now the people living with HIV have to go to the public hospital where everybody else is being treated, and that means that you'll also have to pay for those services, and there will not be any confidentiality. It means that many people will not go to the clinic because you don't want to go there and we mama wa ukimwi, enda kwa ile dirisha uchukue dawa pande hiyo. I think those are some of the things that the government needs to look at. They need us to look at a proper transition from the clinics for people living with HIV to where we now get medication without being stigmatized. Otherwise, people are very anxious, and especially in the rural communities. And the other day, I was talking to the director of NASCOP, and I told him people are anxious and they don't know about their medication continuity. As much as you're telling us that we have medication for 6 months in the country, what happened after 6 months? What happens after the freezing of the administration for Trump is lifted? If we do not have medications in this country, we will go back to where we were. We will have lost all the gains. We'll have children being born with HIV. We'll have people infecting each other. People will not go to hospital to be stigmatized because of their HIV status. They will just be helpless and stay at home. Probably you have a spouse and both of you are taking medication. You will say that, and after it's finished, then what's next?
Quite a sad scenario. There's
Yes.
over 4,000 children that you're supporting now. What happens to them?
This is WOFAK
Yeah.
only. So you can imagine how many other organizations. And in that consortium, I think we were like 7 consortiums. Also, all of them support this. But this is now just WOFAK. What about all the other organizations that were being supported by PEPFAR and UNAIDS?
Yeah.
And even the workers, they were on a salary. They have rent to pay. They have children who go to school. They have different bills to pay for. It just went stop like that, and there's no salary, and you have worked for it.
Wow.
It's crazy.
So thousands of families definitely left without breadwinners.
Yes.
And it's quite. So do you think the government has the institutions in place or even the funding in place to ensure that something happens before if at all the suspension will be lifted?
We do not have anything written from the government, but of course, as advocates and leaders of networks of people living with HIV, we have been having conversations with the government. And just like I told you, they promised this medication for up to 6 months because we relied heavily on donors. We relied heavily on Global Fund and PEPFAR and for medication, which is very risky for a country to do. So we are in conversation, and we are telling the government that they have to up their game to make sure that they have a budget for medication in the next. Actually, like now, we won't even wait for the next budget year. We want a supplementary budget that can be able to buy commodities, buy medication for people living in HIV. Otherwise, we are doomed.
Yeah, talking about the budget, Kenya's health budget allocation is around 3.4% of the total national budget. How do you think this funding is distributed in terms of HIV and AIDS treatments and prevention and support services? And how can this be, advocated for more funding to be put towards towards HIV and AIDS?
Fiona, 3.5 is really small budget for health. And you remember in 2001, there was the Abuja declaration that governments were mandated to have 15% of their budget, government budget, put in health. So if we are talking of 3%, really, we have not even reached half or even quarter. And this should happen every year. So there are few countries that have been able to do that, but Kenya, it has never worked. We have gone from, I think currently we are at 5% government allocation. So really, you wouldn't know how to divide that.
Yeah.
Of course, the counties have been devolved, but then the health budget comes from the national government. Yeah, so unless the county governments also generate funds to for the health services, then I think we are sailing in a sinking boat.
Yeah.
Yeah.
Actually, Kenya depends largely on external funding. You see, like the USAID and other funds. Do you think this is sustainable for a country?
I think I said this before, it is not sustainable at all because another country will also come up and pull and say, okay, education is gone. So I think as networks of people living with HIV and Kenyans as a whole, we want the government to take care of its people as far as health is concerned. We cannot rely on donors who come and go, who dictate what needs to be done. We do appreciate what has happened until now, and that is why some of us are living until today because of the support. But the government needs to be more organized. They make sure that the money that is for health and especially ARVs goes is coming from the government coffer. I would say we are happy to have the donor funds, but as you know, just as supplementary or a stopgap measure to support how do I put it in English, to support what the government is already doing, but not we are relying on it completely. You see, the US government was contributing 1.4 billion towards the health kit. Isn't that the money we are seeing on social media being spent by people? SHA, whatever it is. The government, if there is no corruption, the government should be able to put their monies together and have a better system, especially health system, buy ARVs, and even, in fact, manufacture ARVs locally for here. It would be cheaper. But then because the government relied so much on donor funding, so the monies were going elsewhere. So this is the time that they need to put all that money that is going everywhere, that is being donated to who and who, to put in health system. Otherwise, our health system is gonna collapse.
Yes. You've mentioned a couple of some African countries that have managed to actually move away from aid dependency. Do you have examples of African countries that really are doing very well in terms of looking inward instead of outward for funding of their health programs?
Yes, for instance, South Africa has done very well in terms of healthcare for their people. We have Rwanda, for instance. Rwanda, actually, the funding they get from Global Fund, for instance, goes to Treasury. So the government is able to allocate that to health systems. Then we have Botswana. Botswana is also able to take care of their people, though it's a small country, but they use the people's taxes for health system. I think we have also Cape Verde or somewhere that are able to use the government or the taxes they collect to take care of the sick and also to buy the ARVs.
Yes.
And commodities.
Yeah. Yeah, you've spoken about the challenges that your organization and others are actually facing in this time of the suspension of the aid by the US government. Um, what, how are you surviving? How will you, you know, move forward? Because the government doesn't support you in any way, does it?
No, it doesn't. Fiona, that is a very tricky question. I don't even know how to answer because even to my staff, I don't know what to tell them. They're asking me questions and I don't know what to do. But the only alternative is to look outside, because for sure government will not give civil society money to implement their activities. So we have to look elsewhere. We have to look at probably other countries that can support us, but it is not something that happens immediately, because you have to write proposals to donors to explain yourself and what you do and see how they will support you. But it's not automatic that that will happen. So for now, we are helpless. I'm jobless. If you have one, you can give me. Yeah. So yeah, it is that tough. It is. I have no answers for anybody.
Yeah, quite sad state of affairs as we currently speak. Of course, not just in Kenya, but also in Africa and worldwide, where we had staff who really, all of a sudden, really had no jobs to go back to and, families to fend for. And this has affected a lot. In Kenya, I think it's over 40,000 people directly affected by the suspension of the USAID funding. Now, we've had other discussions about funding and external funding and how African countries continue to depend on funding. And I read a Transparency International report that says left behind, corruption in education, health services in Africa. It highlights how corruption in procurement systems and poor service delivery often obstructs the intended impact of aid, particularly in healthcare sectors. Given these challenges, what measures can organizations like the civil societies just put in place to ensure that, well, there's very little in terms of leaking of this funding, to the inappropriate areas, and also to hold the government accountable, because health is a public good.
I think for civil society, including our networks, which is civil society, we just have to keep government on their toes, on check, and continue pushing them to allocate funds to the to the health kitty education. But for us also, we need funding to do that. We need funding to advocate. We need funding to print those T-shirts, to the placards, to have the meetings with the government. So I think it will be a continuous advocacy for civil society to ensure that we have money to take care of our country. I think somebody said that we cannot rely on other people's taxes that they collect to come and support us, when we also collect a lot of tax in this country as Kenya. So I think we just have to ensure that the taxes go to the right places, go to the education, go to agriculture, go to health, which is actually more important, because if you have a sick nation, then you will not even produce. Agriculture will fail, education will fail. So yeah, we will stay on check. We will have conversations, and we already having conversations with the government, the relevant government authorities to make that happen.
So I'm just thinking about the rural women who really have depended on this aid for a long time, and how they've been able to move from one step to the other, and also to even just start their own livelihoods projects and ensure that they live well. So what happens now? I'm still at what happens to these people, especially in the rural areas.
I think, Fiona, I also have the same question, because these women are desperate. They relied on maybe small funding that's our organizations supported them with. For instance, food basket for those who are not able to even go to the shamba. Like now, we are seeing a bigger number because of ARVs. We are seeing, and especially in the in the villages. So these people are presenting with non-communicable diseases, diabetes, arthritis, and such a things, which are not even supported by the government. So you can see the desperation that they have. They don't have the money to go to hospital, because if you're diabetic, you have to go to the hospital to get your medication, your tests done. Arthritis, the same. So if you don't have anything tangible that you have, like income generating to give you that money to go to the facility, then you will just die. Children will not go to school. It's a multiplying effect. It becomes the mother, then the children, then the whole chain. It's desperation.
Do you have any projects projects for the young people? Because there are reports and discussions on social media that stated that the young people actually are not scared of HIV and AIDS. They are scared of pregnancy. Do you have any programs for the young people and educating the young people? Because this generation, I'm not so sure a lot has been put into educating them compared to our generation. The younger generation looks like a bit more care, a bit well. What word will I use?
Don't care or something.
Yeah, they seem to not really care so much about the infections.
Yeah, that is what has been said. But within the USAID project, there was the Dreams project that looked into. But ABC is foreign. It was the Dreams project that was looking at girls who have not gotten HIV, and they were put into groups and they were taught on how to protect themselves as young women. What we were pushing also was to see if we could have even the young girls who have been infected to join, but I think that didn't work because they were looking at prevention of and not treatment. As a government, I don't think we have that kind of project, and so mostly it is organization, the civil society, that try to come in with different projects that support young girls in the community.
Okay.
Yeah.
Well, another question also. Reports had shown that a lot of infections happen in marriages. A lot of marriages, actually, people get infected while in marriages. Do you have statistics about that?
I know there are statistics, but I don't have that because, like I had mentioned, once you are used to your sexual pattern, you cannot come one day and say, now I have, let us use protective, let us use condom. Because the other partner will ask you why we have been having sex without condom. So what is different? As much as we know that even in marriage there is people still go out of to have sex out of marriage, and I wouldn't say this is only for men. Okay, majority are men, and also women these days in Nairobi is crazy, and yeah, so it's something very hard, and this is things that are done in secretly which you cannot talk about.
Yeah.
Yeah. Oh. I don't have the statistics, but I know it happens. We discuss this in our groups every time.
Okay. Also, there was another generation of young people in their 20s and 30s who were born with HIV and AIDS. And some people said they were never really told their status and they are living and really have not been tested. Is this a problem for the country?
Um, when you are born with HIV, you are born at some hospital. So definitely there is a record in the hospital that shows that you are HIV positive, and they have to initiate you to ARVs. So those statistics are there. We have quite a number of young people who are born with HIV who talk about their HIV status, of course not in media, because they're looking at relationships. Some have boyfriends, but of course when they take their medication, the viral load is suppressed. So the records are there. Stigma might push people not to talk about their HIV status, but I don't think there is a deliberate effort to actually just not talk about your status, because you have a mother who gave birth to you. But disclosure could be a problem. Probably you did not disclose to your sexual partner, but probably you will be making sure that your child is taken care of in terms of taking medication, because you cannot live for 30 years with HIV not getting into AIDS. So definitely they are taking, maybe they're hiding. I know what mostly young girls who are HIV positive complain is the pill burden. So, and then sometimes they say it makes noise when they carry in their handbag, but that could lead to people forgetting not forgetting, actually not taking their medication deliberately because they don't want anybody else to know. Or sometimes they remove them from the container, which is packed, because when you pack medication in a certain container, it has to be in that container because I think it's preserved in that. But then now they have to remove because they don't want other people to know. So you can put it in a bottle that probably is for multivitamin, which is not meant for that. But definitely, I know they take medication. We have quite a number of them. They live their life normally. They are going to university and they are very bright. Actually, the ones we work with, the net, you won't believe it. They are very bright girls. Yeah. To come up with a book, basically to ensure that I empower women and I give information for women living with HIV and people out there, because not many people can talk about their HIV status. So in this book, I have like 8 women who have gone through WOFAK. They have been empowered. They have gone out there to support others. They are in bigger positions. They are working. They are senior citizens. I mean, so for me, if you read this book, because I've had other instances, there's one youth who told me that, Mom, I read your book. And I went to the network, which is NEFAC, which is the national network. And when I went for counseling, they gave me your book. And I was told to go to some corner and read the book. And when I read the book, I think I said, I will never look back. So you are our role model, Mom. And we want to make sure that we stay like you have stayed, and we also grow old and age with HIV like you are aging. So if you read the book, you will see the stories of the women at WOFAK. There are actually 8. There are 8 women, just a few.
Okay.
Of from different backgrounds. Yeah.
Which one is the most outstanding, please?
In the book,
Yes.
I have this one, Ludfin. Ludfin actually, Ludfin lost her husband. When I met her, when she came to my office, she had lost her husband and she had a small girl. So I held her hand and I took her to the clinic where I used to go, and she kept on asking, Mom, am I going to die? Is my child going to die? I said, no, your child is not going to die. But then she said, I will never touch a man again. I said, no, don't say that. Then one time she tells me, Mom, I'm going to meet my prayer partner. I said, this prayer partner, one day. And then all of a sudden, Mom, I'm getting married and you will be the matron of honor. So I told her, what did I tell you? That time you were very annoyed because somebody had infected you. It was not intentional. He was your husband. But now here you are. And Ludfin has gone places. From that time, she went to work with ActionAid, and then she went and worked with UNDP. Right now, she's a project manager at UNAIDS. She's a big person. And then we also have another one, Nice. Actually, she's also one of the members we founded WOFAK with. From there, she's the one who wrote our first proposal. From there, she went and she worked for WHO in Geneva. And then she went to lead an organization in the United States, a network for people living with HIV. And now she works for the American government as a government employee. We have many I can talk about, and I think I have Njoki. Njoki is in Seattle. She's actually an executive director. She runs an organization in the US, which even gives funding, WAKI, which actually gives funding to Kenya. I have, I saw another one here. I have actually Maureen. Maureen Morenga came to WOFAK when she was a very young girl. Maureen is very powerful, and she is both globally and nationally. And Maureen is a very strong advocate, especially for children, women, pregnant women, and to ensure that they get their medication. She advocates for them. She actually fights for them. And she's a member of the Kenya Coordinating Mechanism on Global Fund for Kenya. And she's also internationally a representative for women living with HIV under the Kenya Coordinating Mechanism. Yeah.
Thank you.
So there are quite a number of them. Of course, the other ones are, it's not that they have done nothing, but they are also working. I think some of them have relocated to the United States. This lady, when she was in WOFAK, her CD4 count was 1. She was almost dying. But then with medication, she became okay. So I can go on and go on and go on. Caroline Odada also, she worked for a project under WOFAK, but now in the United States. So I can say that we can count very few who have died, who have gone through WOFAK. Yeah. And that is my happiness.
Yeah. So what should the government do? What would you tell the African governments on the international community right now that it's like everything has come to a stop to very many populations in African countries? What should be done to have self-sustaining programs to ensure that people do not now die because they have nothing else to look forward to? And now, of course, now that people are very desperate without knowing what to do, what would be your final word to this government and international community?
It is my hope that the government will take up on the issue of ARVs and so that we don't die, because there's a lot of anxiety out there. Yes, people don't know whether the medication will be there in the next 3 months or not. People are running to the clinics to see if they could get stock and keep. And yeah, if we can have that information. In fact, I talked to the director of NASCOP the other day, and I told him, please, people need this information. Let them know. We don't want people to be anxious and leave their medication. So I think the government needs to act with speed to ensure that everything is in place and make sure that recipients of care know that there is something they can do. I think for me, to the international community, what I would say is that this stop work thing would have come gradually. Of course, PEPFAR kept on telling the government that in the coming years, we are going to stop funding to Kenya, because I think we have met the targets that we were doing in Kenya. So you need to take that as the government to ensure that there is continuity. But unfortunately, it came before then. So in that case, it means that the government has to go back to the drawing board to ensure that they can be able to take care of their people. I don't know how, but we have the money. So I think they need to come up with a new plan and fill in the gap that the donors were there. But also our wish is if the donors can even give us a few more years to so that gradually we are able to have a sustainability plan with the government and of course with the civil society and organizations that support people living with HIV, malaria, TB. You know, they were even supplying TB, malaria nets and TB drugs and even the tests. So in fact, including the data, the data for HIV, TB and malaria, actually they have gone with it. So we don't have data for our people. You can imagine what's going to happen. They're going to go back to our old files that have not been, I think we have not used those files for years. So I think we need to work smart in future and to avoid such things. But we have to own, as a government, the government must own their people, make sure that healthcare is a government business and not donor business.
Thank you. What is you said the government needs to communicate. How does government effectively communicate some of the things that they're doing to ensure that people are less anxious?
I think right now it's easy because we have county government. So the national government should be able to talk to the county government and let them just sensitize the people. We can do it on social media, you know. Although sometimes social media information is misinformation, but they can talk to their county government to actually sensitize the people through the chiefs, through, barazas, that way it will go, because we are now an organized 47 counties, 47 governors, and they have a lot of staff that they are paying there. Yeah.
Thank you very much, Dorothy, for having time to speak to us today. And as you've heard, we have thousands of orphans who don't know what to do. We have thousands of families who've lost their livelihoods because of the suspension of USAID, and the government that has not put in place measures to ensure that there is effective communication on what needs to be done at the village level and in the rural areas to ensure that people are less anxious. Thank you for having time to watch us today. Please like, share, subscribe. Until next time, thank you.